Hi there. My name is Apryl Parcher, and I'm a master certified primal health coach. But before I became a health coach, I had many of the same problems that a lot of people today have experienced as they approach their 50s and 60s. And it wasn't until I had a couple of wake-up calls that I began to take this seriously. Like many people my age, and I'm going on 67, there are some health issues in my family. My parents both had reproductive cancers. My grandparents had heart disease and diabetes. My sister has thyroid issues. My mom had Alzheimer's, and she died of lung cancer before the Alzheimer's took her. Typical things that plague modern society today. But I really didn't pay attention to that until I started having some of the same issues. It became very easy for me to gain weight when I was having children. That was in the 80s. And my father-in-law had gone on the Atkins diet, and so did I after my first child. And I lost a good bit of weight, and I felt pretty good. But people around me started to tell me, oh, you can't sustain that. It's not sustainable. It's really harmful long term. You can't just live on meat. And I believed them. So I stopped the diet and kind of went back to the same old standard American diet. I had problems with my menstrual cycle from a young age, had to have surgery for endometriosis. And during my last pregnancy, I discovered I had maternal diabetes. Um, that was a wake up call, too. But my primary care physician noted at the time, before I started having kids or after my first child, he started to look at my blood work a little more carefully, and he noticed a trend, my blood sugar going up in a trend, and told me I needed to get a handle on it. So he sent me over to a dietitian, and she hooked me up with a lot of brochures and pamphlets from the American Diabetes Association and a glucometer to check my blood sugar. But I found it difficult to follow the recommendations of the American Diabetes Association. They required certain amounts of carbs, and I couldn't get a handle on it. I was carb addicted, and I really couldn't get a handle on it. It was frustrating. So during my kids growing up, I was busy. I had my own business with lots going on. So when aches and pains started to happen around my 50s, I just chalked it up to getting older. That I had a frozen shoulder, well, both sides actually, one after the other. Plantar fasciitis for several years that needed intervention, worsening arthritis, a lot of aches and pains. I got through menopause okay, but after that, my weight really got out of control. Nothing seemed to help. I tried different diets. I tried Weight Watchers. I tried Nutrisystem. I even tried drinking a liter a day of vegetable fruit smoothies. I started to have heart palpitations at night, and a high resting heart rate. And I began to think about my dad. Those particular things brought me back to him because he developed AFib and had to have an ablation on his heart and also was on lots of medication. He ended up with sarcopenia and neuropathy to the point where he has to have a walker just to get around the house. I also worried about my worsening brain fog and thinking about my mother and thinking, is this the beginning of Alzheimer's? I don't know. And then one night I had a big problem. I woke up in the middle of the night with my heart pounding out of my chest. I couldn't control it. It felt like it was racing and then it would stop and race and stop. I thought it was dehydration, but no amount of water helped. And this is in the middle of the night. So I woke up my husband and he took me to the ER, and it was AFib. And it took hours and hours of an IV drip to get with medication to get it under control. That was in 2022, wake up number one, but it wasn't enough. A year's worth of medication and changing our diet to more vegetables and meat and less carbs helped somewhat. But I'm still a sugar addict, and we had started a veggie and fruit smoothie regimen, bought a Vitamix, and invested a lot of money in the Vitamix and tons of green vegetables. But I weighed 214 pounds and I could not kick the carbs. My oldest daughter was worried about me, and she told me about this carnivore diet. She sent me some videos on it, Michaela Peterson and her story, Jordan Peterson. She was really worried about me, as was everyone else. And I knew there was something really, really wrong. I was going down the a wrong road. And if I wanted to have any kind of life with my grandchildren, I'd better, get my act together. So my husband and I decided in October of 23 to try this carnivore thing. And I like meat. So what the heck? besides Atkins had been the only thing that had worked before. So I thought, well, let's try it again. Maybe it's different. 1 month was good. Second month was better. And I went in to get a full blood panel. Second wake up call. My fasting A1C was 7.8, well into type 2 diabetes. Wow. This must have been worse 2 months before. We'd been on the diet 2 months. So what was it before? And my triglycerides were over 300. So terrible news. And since my primary doc back in Maryland, who had talked to me about the diabetes, no one in Delaware had said anything to me about my blood work being off. I must have been pre-diabetic for a while because we moved here from Maryland in 2015, and I'd never had a diagnosis of this type before. Um, and I had a new cardiologist, and when she saw the numbers, she flipped her lid. She said, promise me you will call your primary care physician and get on medication today. You have to be on medication. You are diabetic. And I told her, well, I'm trying to reduce this with diet. We've been on a ketogenic diet for 2 years. And she said, oh, no, 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 you can't be on a ketogenic diet. It's bad for you. You could die. You could die of ketoacidosis. Promise me you'll talk to your primary. So I promised her we would talk to the primary, but we stuck to our guns. And I watched every YouTube channel I could come across about this type of diet, a ketogenic diet spectrum from paleo down to keto, carnivore, lion diet. And I read everything I could get my hands on. And then I found Dr. Ken Berry's Proper Human Diet Community, and that really saved me. Um, I was able to, at 6 months, I had lost 30 pounds, and my A1C dropped to 6, which is pre-diabetic, and my triglycerides dropped from 300 to 70. At 12 months, I was down 40 pounds, and I stalled for a bit. But through the community, I found that more walking plus intermittent fasting, changing what time I ate, really helped a lot. And we've been working at this ever since. And now I fit into clothes that I haven't been able to wear in 15 years. So it's pretty awesome. But like a lot of women who have been navigating menopause and middle age spread, I've been where some of you are who are watching this. I was under the impression that the food pyramid was the result of a lot of study and testing, and believed that there was something wrong with me, that I couldn't discipline myself enough to keep from gaining weight while following that regimen. I trusted that my doctors had nutritional training and that they kept up with the latest literature on health issues. Otherwise, why would they advocate for a low fat diet? And I believed that the cereal labels said that they were heart healthy because surely their ingredients were tested by the American Heart Association, right? But finding out that the opposite was true of all these things, beginning with the food pyramid, and also learning about blood work and what it meant. So being my own advocate, learning what all the blood tests are and what they mean and how I can follow my metabolic journey by looking at the blood work more closely. I also looked at anthropological research, including stable isotope testing, to see what our ancestors actually ate and thrived on, and about what a species appropriate diet is. And finding out about that doctors actually have little or no education on human nutrition requirements when they're getting their medical degrees. I also found out how the food and pharmaceutical industries have manipulated our food and medicine in the last 100 years, and not in a good way. And the more I learned, the sadder and the more angry I became that my parents had been duped into feeding us things that actually were harmful and set us up for lifelong metabolic disease. And that the medical system of managed care was essentially broken. And that I'd lost loved ones that did not have to succumb to modern diseases that we have today. It is an ongoing journey back to health, and I'm still learning. And yes, you can take back your health from the ravages of heart disease, diabetes, chronic kidney disease, IBS, even Alzheimer's and other neurological conditions. It's not too late. Our bodies are smart, they're resilient, and have the remarkable ability to heal themselves if given the right environment and the right nutrition. I made it my mission in life to help other people, especially women, unlearn the mistakes of the past and get familiar with their bodies again and to learn how they can achieve an effortless relationship with food and movement, an ancestral approach that we know gives us the absolute best health we can achieve without starving ourselves, without constantly thinking about food, without counting calories and macros, and without spending hours in the gym. We can do it from home, and we can actually save money on groceries that don't serve us and actually do us harm while enjoying being active again and without the aches and pains we used to think of as old age. I did it, I'm still doing it, and you can too. I will help you. So thanks for listening. And if you've enjoyed this content, please give it a thumbs up on the video, and please share it with someone who you love, who you think needs to hear it. Thanks again.